So one thing we like to talk about with patients as we're looking at different issues they have in their mouth is we like to explain to them how their body is supposed to work, whether they're a child, an adult, regardless of where they are. We like to explain that ideally you take air in through your nose, filter, purify, humidify it, and introduce it into your body. The right quality of air is so important, as well as the right quantity through your airway. Once that oxygen goes into the body, we explain in a very simplified way to patients so that they understand that oxygen is dispersed all over. So it goes to our brain so we think clearly, it goes to our heart so we pump efficiently, it goes to the digestive system. We know that digestion is important not only for detox through elimination, but our immunity originates in our gut and our neurotransmitters originate in our gut, which is why our diet's so important. It goes to our urinary system so we have proper bladder control, our endocrine system so we have proper hormone control, feeds all those vital processes. Also feeds the muscles so we have proper muscular endurance, which is so important for little kiddos trying to excel in their sports. Goes to our skin so we have nice, beautiful skin. And then during the night, it allows us to cycle through the sleep cycles. Each sleep cycle is critical for overall health. We have alpha, beta, delta, and REM. In a very oversimplified way, we can talk about delta sleep being so important for liver detox. So regardless of how mean and green and clean you eat, if you don't get into that delta sleep, allowing your liver to detox, if your lymphatic pathways aren't open, we're gonna have a buildup of that. Brain detox is equally as important. There are studies that show if we don't get into that REM sleep and have proper brain detox, we can get a buildup of beta amyloid plaques. Those beta amyloids are surround the thoughts. So all day long we have thoughts, ping, ping, ping all day long, right? We get into REM sleep, the brain shrinks and it flushes out all of those beta amyloids that surround our thoughts all day long. If we get a buildup of those thoughts in our brain, we have brain fog, right? Originates as brain fog in the beginning and can even, recent research says that it can even evolve into Alzheimer's or dementia. So for me to have a conversation with a 3-year-old's parents and say your child is not getting into has sleep disorder breathing, is not getting into proper REM cycles, they're at a higher risk of dementia and Parkinson's. And the mom's like, wait, this kid's 3 years old. I understand, but that's how we fix things. We start at the beginning. We don't wait till it's an end-stage disease. Those are conversations we have every day. What I like to point out to patients is because we're so healthy, because our instinct to survive and to breathe, quite honestly, is the strongest instinct we have. Our body's ability to compensate and adapt is greater than anything. And we see those adaptations in a lot of different ways. So if patients mouth breathe, for example, they're not using their nose to filter and purify that air. What does it instead? The tonsils and adenoids, they filter and purify it, so they get bigger and bigger. ENTs here in town are very quick to take those tonsils and adenoids out because they're so large and we're getting chronic infections. The problem is we're not addressing the root cause, which is the mouth breathing. So tonsils can grow back. I had a little girl in the other day, she's had her tonsils and adenoids removed 6 times at UT Southwestern. No one ever addressed the root cause of her mouth breathing. Guess what? We addressed the root cause of her mouth breathing. Now she doesn't have to have that surgery. So there's lots of different, was the ENT wrong to take out the tonsils and adenoids? No, they were huge, but there could have been further support to do that. So there's lots of different ways when we talk to patients how we can ideally get the proper oxygenation in the body. If we're not getting the right quantity of air through the airway, maybe the tongue's falling back, maybe the lower jaw is underdeveloped, maybe there was orthodontics that retracted everything, pushing the tongue backwards rather than pulling things forward as how they naturally grow and develop. We look at the ways that they compensate. We see teeth grinding, bringing the jaw forward to bring the tongue out of the airway. We see all sorts of different compensations, bedwetting, chronic digestive issues, endocrine issues, adrenal fatigue. The list goes on and on. We see it in children and it manifests one way, but as adults become older and their body's ability to compensate becomes much better, it gets masked a little bit. And quite honestly, that the masking or the compensations that they do are very easily excused. Well, of course I grind my teeth. I'm stressed out. Hey, I'm stressed out, I don't grind my teeth, right? There's so many ways that people rationalize that. So we really want to jump into solutions, and we're not looking to really reinvent the wheel. We have a few different options that we present to patients. One is nothing. And I tell patients, hey, you don't have to do anything. You're thriving, your children are happy, you have your dream job, everything is good. You don't have to do anything. But if you choose, here's some other options. It makes sense to me that we got to get you breathing through your nose. And sometimes that inflammation in the nose is caused from the mouth breathing. So you breathe in air, forcing tonsils and adenoids to filter and purify it. It's not their job. So the air goes into the lungs, and the lungs are like, what is this? And you have an inflammatory response, so you can't breathe through your nose. So we've got to clear the nose first. That goes with some nasal lavage, and that's just a fancy way of saying snot protocol. We just got to get everything cleaned out. There's a lot of natural over-the-counter ways you can do that. Sometimes there's dietary modifications you can make. Decrease the inflammatory foods, the gluten, the dairy, the sugar. That'll help open things up. That can be tough. Behavior modification can be tough for patients. So where I like to focus is getting the right quantity of air through that airway. A couple of options there. You can get a CPAP. Not all patients qualify for that, and we work with our medical doctors to look at that. The problem is the CPAP failure rate is so high, and this is why. We say how important it is to get the right quality of air. We also know the right quantity through your airway. What CPAP does, continuous positive airway pressure, is what that stands for, as it applies a mask, whether it's to your nose, to your face. The inventors of the CPAP are so creative. How can we strap something to your face and minimize it, rebrand it so patients will accept it, right? It's a nose pillow. I mean, it's genius. Everyone hates the nose pillow, but how do we put that on there? Then we have to set it with a certain amount of pressure to blow air in at a rate that keeps the airway open, keeps the tongue out. It's brilliant. It's on paper. But when you get it, on a patient's face, the problem is we're blowing air in so fast, the nose can't filter and purify the air. So now we're getting even more inflammation from that. It blows in so hard, the mouth is really dry. Well, now we're seeing cavities and dry mouth, right? So it sounds great on paper, but not many of my patients don't accept that as the resolution. Another resolution would be, we've got to get the tongue out of the posterior part of the tongue out of the airway. There's an ENT at UT Southwestern who's happy to cut the posterior third of that tongue off. There's 2 floors of ICUs that they're doing that for. There's a wait list to get that procedure. Some patients like that. It is my philosophy, if there's a non-surgical, less invasive, holistic way to do it, let's avoid that surgery. So most of my patients don't accept that as an option. The next option is to see an oral surgeon. They can expand, in an adult, they can expand your arches by using implants. It's a surgical approach where they break your jaw, bring it forward. Issues with that are the recovery time. Obviously, it's quite expensive, changes your appearance, so most adults don't want to completely change the way they look in the middle of their life. But it is an option, and it's really popular. A lot of dentists are talking about it. A lot of oral surgeons who work with orthodontists are looking at it. Again, it's a more surgical invasive approach. Another approach that you can do, if we think about it, okay, we've got to get the right kind of air, we got to let the nose work, maybe a little bit of work we have to do to clear the nose so we can actually use it, and we've got to get the tongue out of the airway. So what seems most logical to me is if we use a TAP appliance, we put it, if it's on the top and the bottom, and it changes the relationship of the jaws temporarily while you sleep to bring the tongue out of the airway. So now we're getting the right kind of air through our nose, and we're getting the right quantity of air through the airway. And we're doing it in a holistic way that, yes, we're utilizing the appliance. You have to wear the appliance to establish the relationship, but we're doing it in a way that allows the body to work the way it's supposed to, ideally. The thing I love about the TAP appliance is we're able to adjust it. So sometimes patients need a certain jaw relationship because they're so inflamed, they're so swollen. We have to really work hard to get that tongue out of the airway. As they begin to get into the delta sleep and REM sleep, we see that inflammation decrease. We see their body start healing themselves. We see such positive changes that we can titrate that appliance. We can change the relationship of the upper and lower jaw so that we're still maintaining the right quality of air, but also the right quantity of air. And patients love that. They love that we don't have to remake the appliance if things change. We can just work in real time, listen to their body. Oh yeah, allergies are crazy. Of course you have more inflammation. Let's adjust it a little bit. Oh, you went on a tequila bar crawl. Yeah, of course you're a little more inflamed. Let's change it a little bit. Wow, you lost 50 pounds? That's amazing. Let's adjust it a little bit. So they can be positive and negative changes, but we can evaluate it in real time and give a real-time solution that allows them to sleep good. Because the real problem is once you get patients sleeping better and breathing better, if there's any compromise, they won't go back to the way they were. They demand that new lifestyle. They demand this is how they want to feel. And so the TAP appliance really gives us empowers me as a doctor to give them that solution because they're not willing to compromise once you show them the other side of things.